The opioid crisis has been called the worst health crisis in American history. More Americans die due to drugs than car accidents. And this crisis affects everyone, rich and poor, in rural and urban areas. I recently sat down with one leader who has been fighting the war on drugs for almost 30 years. Joining me now is Bill Bennett, the first director of the Office of National Drug Control Policy. Welcome to the program.
Drug czar, as we used to say.
That's my line. I was going to say you were known as the drug czar.
Sorry, it's my only laugh line.
The statistics around opioid-related drug overdoses are just staggering. 91 people die of an opioid-related overdose every single day in this country. Put this in historical perspective for us, please.
As my friend John Walters, who succeeded me as drug czar, wrote the other day, drug trafficking in America right now may be the largest criminal enterprise in American history. The amount of drugs brought into this country and sold to people illegally, which causes death and despair and the abandonment of children, is the worst it's ever been. I was there during the crack epidemic. That's sort of why they created my office. Joe Biden and others in the Senate created my office, and it was a very serious thing, very awful epidemic, and we were on the cover of all the magazines and newspapers with crack.
But
this
today,
is much worse. It's much bigger. It goes to more parts of the country. The crack thing tended to be isolated and devastating in inner cities. This thing is all over the place. Interestingly,
rural,
probably more rural than anywhere else, but it's making headway everywhere. The problem is, Lauren, I think we are going about it the wrong way.
Tell me about that. You say, this was shocking to me when I read this, that the real problem isn't the overprescribing of opioids by doctors and hospitals, medical professionals, but it's the illegal opioids like heroin and fentanyl.
Let me be very careful here. This is a problem, the overprescribing. It is still a problem. And the problem may have started, at least in terms of historically, may have started with more overprescription causing problems than anything else. And we still have pill mills, and we still have some doctors who are prescribing too many. But not my theory. The facts are the facts. And the facts are now, those numbers are going down. Some states have regulated. There's been some other regulation in the industry, in the medical industry, in the pharmaceutical industry, so that there are fewer pills going out to people who need them, and B, that will be abused. Nevertheless, the deaths keep going up. And why do the deaths keep going up? Because of things like heroin, $2 a hit in many places, $2, and fentanyl,
and readily available.
And readily available, pouring in from Mexico, and probably going to make its way in from China as well.
So the Senate health care bill includes $45 billion over 10 years to fight this epidemic. Is that the right place to be spending the money? Is it going to make a difference?
There will be some state discretion on this money, which is good. And I think we should give people in the states their head on this. Let them think what they do is best. Let them do what they think is best. But unless we get on the supply side, what used to be called the supply side, the interdiction side, the use of real intelligence, unless we tell the Chinese we are not going to tolerate sending these things in anymore.
Not the Mexicans?
And the Mexicans as well, absolutely. I'm just worried about the looming China problem, which could dwarf the Mexico problem. So these are matters of international relations. The State Department has to be involved as well. The other thing is, and again, I know conventional wisdom, I have been to all the major treatment centers. It is fine to give people support for treatment and to help rehabilitate them, but the success rates are small. It's a small percentage.
20%?
15, 20, 25% of people are level with you. Obviously, the best thing to do is to keep people from ever getting on in the first place. Figure of speech I use, a lot of people don't like it. So if you have beachfront property and people are swimming and they're losing limbs to sharks, and you can open up prosthetic limb stores on the beach, but get the sharks out of the
infested water.
Yeah.
Is a border wall going to stop trafficking?
It can help, but it's only one step. There's a lot more we need to do.
The Justice Department announced a nationwide crackdown. They arrested 400 people for healthcare fraud and opioid scams, totaling $1.3 billion. How important is that approach?
That's good. There are some successes. People can take a look at Southern Indiana in 2014, coordinated efforts, law enforcement, the treatment community, the prevention community, the schools, the churches, adults, parents. You remember there was attention paid to the drug problem in the late 80s, and things got better. People don't know this either. In 1979, we had maybe 25% of people using illegal drugs. Those numbers dropped in half by 1992. The country paid attention. We pushed back. Remember the ads? This is your brain on drugs.
Drugs with the fried egg.
Right.
Yes,
you got to push back just as hard on this.
And Nancy Reagan saying, say no to drugs.
Yeah, you know, the intellectuals made fun of it, but parents thought it made sense, and kids thought it made sense.
And it worked. All right.
It was simple for them to remember. No.
Thank you so much, Bill Bennett. I appreciate your time.
Thank you.